Hi, my name is Tanya Krebs, and I'm talking about a sore throat. Now, not many of us would be very concerned about a sore throat. However, if your child has a sore throat, I would request that you monitor it very closely. A sore throat could actually be strep throat. Strep throat does not seem like it would be that big of a deal. It seems like it's a normal childhood disease. Most children get it. I know I had it a lot when I was a child. It is a very serious condition, and it has to have antibiotics to treat it. This is a picture of what a throat would look like if it had strep throat. Not very pretty looking. It looks very painful for this child. So I'm sure you've all had a sore throat and just not felt well, but you didn't really want to go to the doctor for a sore throat. Well, guess what? If you have a sore throat and it's strep, you have to have antibiotics. If you have strep throat, you will have a fever, sore throat, chills, aches, not want to eat, not want to drink. You or your child is not going to want to take care of this. So after listening to my speech, you will understand the significance of taking your child to the doctor with a sore throat. I would suggest listening to your child. If your child says, "Mom, my throat hurts," or "I don't feel very well," I would suggest that you pay attention to your child. I did not necessarily do this. And we paid the price for it in the end when we could have just taken her to the doctor for a sore throat and been done with it. You're going to have to watch your child's temperature very, very closely. If it gets above 101, I would take them to the doctor immediately. Number 2, make sure they drink plenty of fluids. This is our responsibility as parents to make sure the children are not going to want to drink. They're not going to want to eat. Their throats hurt. They don't feel good. They're just growly and they're not feeling well. And it's your responsibility as a parent to make sure they get plenty of fluids so that they don't get dehydrated on top of not feeling well. So if the fever persists, you need to call the physician, make the appointment. Make the nurse aware of the dire need for your child to get in immediately to see the physician. If you cannot get in immediately, then you can go to an urgent care center. They're located all over. You can go to the multi-care website, and they will give you the location and phone numbers of all urgent care centers in King and Pierce County, even Snohomish County, all counties. Multi-care has a huge reference list of urgent care centers and physicians that are there to help your child. So with this strep throat, what your child will do, they will go into the doctor's office. The doctor will look inside the throat of the child, take a Q-tip, put it in the back of the throat of the child, rub it around a little bit. So they can take either, maybe both, a rapid culture that comes back very, very quickly to let you know whether or not your child has strep throat, and they can also send it off to a lab where they will grow it on an agar plate, and then they will be able to tell you what strand of strep, if any, is on there. As in our case, our daughter's rapid strep test came back negative. However, the doctor was so gracious enough to send out a real culture. We got the phone call the next day that our daughter, yes, had strep throat, to get the antibiotics started. Well, we got the antibiotics started right away. We thought that we had everything taken care of. However, we were mistaken. The strep throat had turned into scarlet fever. This is why it's important to take your child to the doctor for a sore throat. Scarlet fever is a rash that covers the child's body from head to toe, mainly in the trunk, around the armpits, the stomach. My daughter Chloe's was on her cheeks mainly. It started as bright red patches. Over the next couple of days it progressed into a bright, chunky, red, blotchy, felt like sandpaper all over her little body. And she had it literally everywhere, inside her ears. The only places that she did not have this poor rash was on the palms of her hands and the bottoms of her feet. So the doctor will give you the antibiotics to treat the scarlet fever and the strep throat. Well, as in our case, the strep throat did not only become scarlet fever, it also had turned into something called rheumatic fever. So if your child has been diagnosed with strep throat, has been diagnosed with scarlet fever, and starts to have weird movement on their body parts, or they start to have lots of joint pain throughout their body, you need to get back to the doctor right away. They possibly could have rheumatic fever, which in our daughter's case. So then if that is diagnosed, then you will go to a cardiologist, and the cardiologist will check the heart and make sure that none of the valves or the linings of the heart have been compromised. You may have to go on anti-inflammatory medication for 6 months to a year after this happens. And then they're going to want to check what they call an echo. That's the picture of your heart after 6 months to a year to make sure that no further damage has been done. Like I said, please, please, please take your child to the doctor if they have a sore throat. Do not let it progress to rheumatic fever. None of us really anticipate that a sore throat is such a horrible thing, but it can be deadly, literally. Get informed. Check WebMD. They have tons of information out there. If you have questions, ask your doctor what to look for if your child has a sore throat. Just please be the advocate for your child that your child needs. Thank you.